In our considered view as MedRAP, it is our belief that the Zambian health budget for 2026 should focus on building resilient systems in accordance with the Ministry of Health, there's a 2026 to 2028 medium-term expenditure framework. In this regard, the key areas of focus should include number one, increasing the budget allocation so that it can be increased from 10.7% in 2025 to at least 15% in 2026 in accordance with the Abuja Declaration. This increment will make sure that the national health budget is able to absorb some of the shocks that we've been able to see as a result of donor fluctuations, in terms of the support to the health sector. And also anticipating any cuts that may come as a result of, donors that have already threatened to reduce the budget and support to the health sector. Number two, there should be also focus on community-based solutions by implementing innovative community-based solutions for rural health centers, especially. This will include, initiatives such as strengthening the health neighborhood, committees, improving the status of the community-based health care workers, and also we would like to see the Ministry of Health also bringing about and expanding, the coverage of the polyvalent community-based workers by also being able to remunerate them so that they are, made more responsive to their work. There should also be a prioritization of community needs. This is where now we think healthcare directors at provincial level will need to really prioritize, service delivery to the communities. We need to see investment being robust, especially in the improving, health systems. We need to build health systems that are capable of withstanding any shocks and improving national health outcomes at that level. In this regard, what we think that there should be critical areas of funding should include, of course, reproductive health, funding that is in maternal health, neonatal, child, and adolescent health also, including issues of family planning, maternal care, and of course, immunization, nutrition, and general health, programming. We also want to prioritize as a critical area health infrastructure development. In this regard, we would like to see an expansion and further, building of maternity wings in all the facilities, as well as the adolescent-friendly services that will offer, adolescent-friendly, services to our adolescents, especially in the rural areas, in the chiefdoms, and the far, lying areas. We also think that another critical area of focus should focus on recruitment of healthcare personnel so that we can address shortages of healthcare personnel, especially in the rural areas. We would like to see another huge, program that will bring in, a considerable number of healthcare workers to be employed by the Ministry of Health. Another critical area that we think there should be improvement on is the procurement of essential medicines and supplies. We must say that government has done quite well in the procurement of these commodities. But we think that with improvement in the infrastructure and of course in systems, there should also be improvement in terms of the distribution of these medicines and medical supplies, to these facilities. We need to see a situation where at facility level, we create more pull factors for these, essential medicines. We do acknowledge that the healthcare center kits are really doing quite a lot, but it's still largely, a push factor, and to some extent, it is going to lead to wastage of medicines and also shortfalls of medicines in some facilities because it does not take, care of, fluctuations in disease patterns as a result of weather, environment, and other geographical, issues. And so I think that we should be moving to a system where we have the facilities themselves being able to pull these products so that the facilities are only ordering commodities, that are actually essential, or rather are actually needed by the facility and the communities where they are. And again, talking about this issue, while we do understand the fact that the Minister of Health, especially as ZAMRA, as the issue of ZAMSTA, maybe is still in a, in a state that is needs more attention. But we think that as regards some of the threats that have been made by donors, in particular the American embassy, in addressing the corruption within the sector again, we feel that government at this stage have taken significant steps to try and address this issue. We know that it is still work in progress, but we would like to, at this moment in time, also take advantage of this moment to begin advocating that the imminent threat to cut, of course, support to the health sector by the American embassy may actually should be reviewed, looking at the effort that government is actually putting in place so that we can avoid destabilizing the situation in the sector further. We will take time as MedRAP to try and, of course, write and, of course, communicate with the embassy about this decision so that we can give an opportunity to this particular government for the efforts that are being made in the sector. But, of course, notwithstanding some of the issues that we've pointed out, where there still need, for improvement in the supply chain of medicines.